Dr. Ashad, keep quiet. Huh? When I go live, I'll start.
Okay.
Good evening, everybody. I'm Shrikant. I'm the head of operations for AyurUniverse, India's largest wellness portal, offering preventive wellness, ailment management, online and signature programs in yoga, Ayurveda, and naturopathy for global customers since 2016. AyurUniverse currently hosts more than 300 wellness centers in India and abroad. With a large presence in India, Sri Lanka, and Nepal, we plan to have a global presence in the coming years. Customers from more than 65 countries have booked their wellness program through our portal. We are approved by Department of Tourism Karnataka, Incredible India, and we are a member of Global Wellness Institute, California. Today, we have a webinar in collaboration with Abad Hotels and Resorts and their flagship product, the Revival Ayurveda Center. We are presenting your webinar on the topic prevention and management of arthritis through Ayurveda. Just a brief about Abad Harmonia Ayurveda Health Garden. The property is located on a lush green area of 1.5 acres of land. The therapeutic and wellness treatments are carried out under the expertise Dhanvantari Vaidyasala, an Ayurveda fraternity with over 8 decades of proficiency in the science. It has superior 27 suites and 7 cottages with private balcony, snuggled near the soothing waves of Chowra Beach. It has 4 treatment rooms well equipped with wooden treatment table, steam chamber, Shirodhara stand to perfectly meet all procedures. They have a well manicured lawns and swimming pool. All of these contribute to the harmonia wholeness of the resort. They offer signature Ayurveda treatments called Ujjvana relaxation massage, Tapta Pashana Abhyanga hot stone massage, Pada Marba Abhyanga foot reflexology, and Udanchana lymphatic drainage. Today we have a guest, is an Ayurvedic expert, Dr. Harshad Damodaran. He is the chief Ayurveda consultant at Habad for the entire group. He also a degree in Bachelor of Ayurveda Medical Surgery from Government Ayurveda Medical College, Tirupundira, has more than 10 years of experience in the field and has presented papers on health tourism in Ayurveda and Ayurvedic wound healing techniques by integrating the concepts of conventional and scientific medical system. Under his leadership, Revival with its 7 centers across Kerala has successfully treated arthritis, neuromuscular debility, fibromyalgia, stress and burnout troubles, ligament, tendon injuries, and etc. Now, before I get to ask Dr. Harshad a lot of questions related to arthritis, Doctor, can you please let us know if there's something special about Abad?
Okay, thank you so much. So, very good evening to all of you. Let me begin the session with a heartfelt thanks to Mr. Srikanth and the entire AyurUniverse team for inviting me to the webinar series and giving me an opportunity to discuss on arthritis and its management in Ayurveda. I also thank him for that wonderful introduction on my profile and also briefing about Abad Harmony. I like to say that Abad Harmony is not only the one center we work with, we have 6 other centers across Kerala, spread across Kerala actually. It is in Wayanad, Munnar, Tekadi, Marari, that is in Alapi, in Kumaragam, and in Kochi, apart from the Kovalam. So all these 7 centers are equipped to do the Panchagama treatments. And we have been in this field for the past 20 years. And we have expertise of the hospital partner also to do all these wellness packages. And our hospitals, our units have a potential to do both the leisure packages as well as the wellness packages. Leisure package in the sense that people can do a wellness tour across Kerala by clubbing with the rejuvenation or the sauna packages. So this is actually that people can see the different destinations of Kerala along with giving wellness to their body. Another one is that we have these therapeutic centers that we can focus on single ailments of the patient, and the patient has to stay on one location and get the treatments done. So our unique selling point is that since we are spread across Kerala, people have a variety of choices, either to choose the hill station, either to choose the beach or the lake Okay, and there are in within the heart of the city, we do have a center. So those who want a leisure destination as well as want to do a focused Ayurveda treatment, they have these stalls. So that is about the Ayurveda Wellness Center about.
Thank you, doctor, for that brief introduction about group. Just to get started, this topic, interesting topic, arthritis, right?
Yeah,
I'm I was always under the impression arthritis means it has to do only with the knees. I
yeah.
think after becoming part of AyurUniverse, my perception about arthritis has changed.
Okay,
So I would like you to explain arthritis to a layperson. What is arthritis?
okay. See, arthritis is actually, for a layman to understand, I would say that arthritis is actually a combination of two Greek words, arthros meaning the joint and itis meaning the inflammation. So it's actually the inflammation of the joint. So wherever you see an inflammation of the joint, any part of your body, it can be related to the arthritis. Okay, so it's not only the knee joint, it can be the shoulder, it can be the fingers, okay, other joints like ankles, wrists, uh, elbows, everything will be there. So this arthritis is actually inflammation of the joint, and we have a few similar symptoms that you see in all kind of arthritis. The symptoms are like pain, swelling, and then stiffness can also be there. To some extent, there can be deformity also. So this is a combination of these symptoms like a pain, swelling, and the stiffness. See these symptoms in arthritis. So a layman can understand that presentation of these symptoms with inflammation of the joint and there's a pain, there's a stiffness, they can term it as an arthritis. So this arthritis can cause from external factors as well as internal factors. Mostly we see because of internal issues we have this arthritis. External factors will be like trauma. We call it like post-traumatic arthritis. Immediately we don't see that after the few weeks or after a few months since the trauma, we see this kind of arthritis changes happening. That's called the post-traumatic arthritis. So it can happen from external as well as internal sources, and then we have these symptoms to be seen. So it's actually typically inflammation of the joint. We call it arthritis.
So what you're telling is very, in simple terms, it is about inflammation in the joints,
Yes,
and because of that, you may have pain, you may have swelling, you may also have sometimes deformation,
yes,
and you also mentioned that it
stiffness.
need not be only external; it could be also internal, right? So you
Yes,
also spoke about post-traumatic arthritis.
yes,
Now, what is Ayurveda's perspective to arthritis,
yes.
and what is the relevance of doshas to arthritis?
Okay. This is a very relevant question in this webinar. So I would say that arthritis has been, it's not in the term arthritis. We have the term called Vata Vyadhi being mentioned in Ayurveda. And all of you know that this Ayurveda has been written centuries before. So in ancient time also, these kind of problems have been a serious concern among the people. So that's why this disease has been mentioned in our text. And we do have different protocol for the treatments that we need to adopt in each of these kinds of arthritis. And arthritis, as I said, is a Vada Vyadhi. We have different terms which we can correlate to the modern terminology. Okay, to cite an example, we have Amavata. Amavata is actually a very familiar term to many people, and there are difference of opinions regarding Amavata. People may say that it's a rheumatoid arthritis, but in Kerala, we have a concept that apart from rheumatoid arthritis, Amavata can be related to rheumatic fever. That's the condition. Rheumatic fever is a condition where there is a fever is also accompanied with a kind of pain. And very less people are well aware of this rheumatic fever because this rheumatic fever may last for a little while only because you see you have a pain along with the fever condition, and then after that it will relapse, and after a few months you get the pain. So this rheumatic fever has a tendency to get land into rheumatoid arthritis. So that's the condition. So rheumatic fever can be related to Amavada, where we say there is a toxin is the reason for this kind of arthritis. Ama is actually the toxin, and these toxins are actually blocking the channels, and Vada cannot travel through these channels, and it gets initiated, and then starts localizing these doshas. The blocks start getting localized in different parts of the body. And one of the major organ that is affected because of this rheumatic fever is the heart. So you get endocarditis in these cases. The main criteria that there is a major and minor John's criteria we mentioned in the modern science, which is related to rheumatic fever. And in that science, we see that there's in the major criteria, there is a carditis as a symptom. So this carditis is a symptom that we see in rheumatic fever, and we relate this actually the reason as the armor, and there is a fever being accumulated. And then we have this rheumatoid arthritis, which we call it Vata Shonita. Vata Shonita, because in this chapter of Vata Shonita, we have been mentioned about two stages that you can see in Vata Shonita. One is Utthana Avastha and Gambhira Avastha. Okay, so for the layman to understand, I say that Utthana is actually the superficial thing, and the Gambhira will be the deep seated. So in the superficial arthritis, superficial Vata Shonita, we have these symptoms related to the pain in the finger joints. So there's a pain. You can see the finger joints are getting painful. Even the toes are also getting painful. And then you can see the inflammation also there along with the pain. And then this goes to the next stage called Gambhira, where there's a deformity happening. And this deformity is due to the deep-seated location of these doshas. So rheumatoid arthritis, we call it Vata Shonita. We had two stages, and this classification, like pain starts from the minor joints and then migrates to the major joints. This is also told in the modern science. So that's the reason why I say that this Vata Shonita can be related to the rheumatoid arthritis, and we have definite protocol for those treatments. The treatments adopted in Vata Shonita is very much different from Vata. I mean the rheumatic fever, which we call Amavata. Because in Amavata, we need to focus the Ama condition. In Vata Shonita, we have to focus the Vata and the Rekta condition. And then we have relevance of Ayurveda in arthritis. Actually, we do have different other Vatas also been told, like Rekta Vata. Again, that is a condition where we have crystals being deposited in joint. We know that gout arthritis. Okay, so this gout arthritis we can relate to Rekta Vata. And then the very familiar arthritis that we see in every people, mostly the aged people, it is the osteoarthritis. So osteoarthritis, we call it like Sandhigata Vata, because that is actually located to one Sandhi. Sandhi means a joint. So in that Sandhi, it is being localized. So this is called the osteoarthritis. So the treatments adopt being told by Acharya, the scholars that who are told the treatments for Sandhigata Vata is very different, and we adopt those treatments for the osteoarthritis. So these are the relevance of arthritis with the being told in Ayurveda. And regarding the doshas, I would say that all three doshas, the Vata, Pitta, and Kapha, all three doshas are vitiated in kind of arthritis. In the beginning stage, we may have the Kapha getting vitiated, but we don't see that in particular. This is actually blocking the channel. Okay, and then the main culprit for arthritis is actually the Vata. Of course, that is why it's been told in the Vata Vyapti. And then we have Roma factor also. The blood is also been affected in this case. And that is the reason why we have this kind of inflammation. So we can correlate, like we can say that, as I said in the beginning, the pain, swelling, stiffness, okay, and deformity. These are we see in arthritis. And we can say this pain is actually be related to Vata. And the swelling, it can be due to the Pitta as well as the Kapha. And then stiffness, of course, due to the Kapha. So we see all three doshas being accumulated in kind of arthritis. Maybe whether it be acute or the chronic stage, acute, and both in acute and chronic stage, we have to understand the relevance of three doshas in the body, and then we do the treatment accordingly.
Okay, doctor. So let me summarize my understanding. So I took a lot of notes. So what you're telling is this arthritis is the modern terminology for Vata Vyati, which has been mentioned in the old text as far as the Ayurveda is concerned. And you spoke about two things, Ama Vata, and you also said Vata Shonida.
Sure.
So Ama Vata means rheumatoid fever, and Ama means toxins. They end up blocking the channel, and it was very interesting to know that I never knew this, uh, that it also can affect your heart conditions, because your channels are getting blocked, and it can create havoc in your heart.
Right.
You spoke about superficial level of arthritis as far as Vata Shonida is concerned, and deep seated.
Yes.
And superficial is about having your joint pain in fingers,
Yes.
and the deep seated will be deformity. I mean that is something very serious. So you said that Vata Shonida means rheumatoid arthritis. So that's what I
Yes.
understood.
Yes.
You also mentioned about Rakta Vata, which is in modern terminology, it's called the gout arthritis.
Yeah.
Osteoarthritis is what you said. Did you say Sandhi
Uh,
Kata Vata? What did you say?
yeah. Sandhigata. Sandhigata
Sandhi Kata.
Vada.
Okay.
Yeah.
And
I just make a correction here. It's
sure.
actually Vata Vyadhi. We have lots of diseases being told in Vata Vyadhi.
Okay.
So among the Vata Vyadhi, because it's anything that is caused by Vata, we call it Vata Vyadhi. So
Okay.
arthritis is one among the Vata Vyadhi.
Got it. Got it.
And
Got
I
it.
didn't went to very brief thing regarding the briefing about the Amavata, because you see there is a kind of streptococcal infection happening in the throat, and this is actually leading to the rheumatic fever. Okay,
Mhm.
so there's a throat infection also been accumulated there. That's why we say actually that typically Jwara. Jwara is actually been there in Amavata, so we treat according to that.
Okay.
Okay.
And you said out of three doshas, Vata contributes, or maybe you need to
Yes.
clarify my response.
Yeah.
The imbalance in Vata contributes a lot to arthritis, and that's where the pain is coming from.
Yes.
Kapha and Pitta, you said it contributes to stiffness. Did you say that?
Inflammation.
Yeah, inflammation.
Yeah, inflammation, particularly the pitta will be there, but also kapha factor is also there. And
Right.
in stiffness, we have the kapha.
Okay, got it. So stiffness is kapha
Yes,
and inflammation is Vata.
pitta.
Okay.
Inflammation is pitta, and pain is
Yeah.
vata.
Yeah, got it. Got it. All right. Okay, doctor. So now that we have touched a little bit on the arthritis, can you explain to us what are the different types of arthritis uh, in
Yes,
detail?
right, right. So I come to all details right now.
Yeah.
And arthritis, we can classify because there are different types of classification that we can give to arthritis. Since this is a session being heard by layperson or common man, I would typically classify arthritis into four subcategories. Okay, one is mechanical. We can say it's a mechanical cause. Okay, so this mechanical, you can take osteoarthritis and, which I said earlier, post-traumatic arthritis. These two arthritis can be taken in the mechanical state. Okay. Uh, when I say osteoarthritis, of course, you know that it happens only with the aged people, and those who are having overweight also get the osteoarthritis because the joints cannot bear the weight. Okay. What happens here is that due to the wear and tear of the joint, the cartilage around the joint starts getting eroded. And once the cartilage is eroded, then you have these joints coming into contact, and then there is a rubbing of these joints, and there the osteoarthritis develops. So osteoarthritis is typically concerned with the cartilage, and there is a wear and tear of the joint, and this mainly seen in the aged people, and some occasionally we can see that in the weight bearing people also. Again, the post-traumatic arthritis is also a mechanical reason, and as I said, it's after a trauma. Okay, nothing more to explain on the post-traumatic arthritis. And then we have inflammatory arthritis. In inflammatory arthritis, why it's called inflammatory? Because there is a blood is being accumulating in that. So this blood is a, once I say blood, of course, people can think about the rheumatoid arthritis. So rheumatoid arthritis is coming under inflammatory arthritis. We can subdivide this inflammatory arthritis into two categories. One is rheumatoid factor positive, and another one rheumatoid factor negative. So these are two cases. Okay. In rheumatoid factor positive, we can see the rheumatoid arthritis and the juvenile arthritis. And rheumatoid arthritis, in simple terms, we can say that rheumatoid arthritis happens, the swelling, the main problem is lies with the synovial fluid. Okay, there's the inflammation of the synovial fluid. There's a, you see, when if there is joint, there is a cartilage between the joints in order to give a cushion effect. And between this, there is a fluid called a synovial fluid. This is actually again protecting the joints in order to prevent the joints coming in contact with each other. So this synovial fluid is produced by synovial membrane, and this is actually getting infected. The reason, as cited by the modern medicine, it is autoimmune. There is no etiology for that. It's autoimmune. It happens. Uh, all of a sudden, it happens. Some triggering factors are there for that. Okay, that has been explained in modern science. But in Ayurveda, we say we have different factors causing for rheumatoid arthritis. It can be your unhealthy diet, unhealthy exercises. If you are too much sedentary, there is no enough passage of doshas will not be proper. So we have our own reason for the cause of rheumatoid arthritis. And then we have juvenile arthritis. Again, the same thing happens in kids like around like 16 years or below 16 years. If we see this kind of arthritis, we term it as juvenile arthritis. So in these two arthritis, we see the rheumatoid factor positive. And there is a negative factor, rheumatoid negative will happen, but we see the inflammatory arthritis in that case also. One of the things is that the psoriatic arthritis. In psoriatic arthritis, what happens? The psoriasis, because of psoriasis, skin disease, again, that is an autoimmune disease. And because of this autoimmune disease, on long standing, being a chronic illness, you get this psoriasis being turned into the arthritis in the major joints as well as the minor joints. You get the pain. So that is called the psoriatic arthritis. Then we have systemic lupus erythematosus. That is a condition. It is we simple terms we call it SLE. That is being seen in many people outside India, even in European countries as well as in America. This SLE, as systemic lupus erythematosus (SLE), that is seen in many people. And again, this is another autoimmune disease. And as the name signifies, it's a lupus. It's a condition happening with the skin also. There's a rash happening, and we can generalize this SLE cases with a typical butterfly rash on the cheeks. You see a butterfly rash on both the cheeks. It will be accompanied by pain, swelling, or fatigue, febrile. All these conditions there we can consider it as SLE, systemic lupus. In that also you get this kind of arthritis. And then we have ankylosing spondylitis. Again, another kind of arthritis affecting the spinal column. On the spinal column, what happens that the vertebra is actually having its shape, and this shape is lost, and too much of calcium deposition will lead to a square shape pattern of the vertebra, and the joint spaces gets narrowed, and it will typically look like a bamboo shoot. Okay, the patient will have very difficulty in flexing or extending the spine. He cannot make movements of the spine. So that is the ankylosing spondylitis. And then we have another condition called Reiter's arthritis. Okay, Reiter's arthritis is not very commonly seen, but Reiter's arthritis is happening due to the genitourinary infection or the gastrointestinal infection. So people who get some urinary infection, they should get it treated immediately. It should not be stayed for long because there are chances that this can go to a next stage or another stage of Reiter's arthritis. Okay, even the gastrointestinal problem like acidity, all these kinds of problems, if there is gets infected, and it can lead to this kind of arthritis. Not to all people, to some people. And in Reiter's arthritis, when a person comes to us, we look into three symptoms that for again to understand for the common people, I would say that the patient cannot see, he cannot see, he cannot urinate, and he cannot climb a tree. These are the symptoms that we see. He cannot see because his eyes are getting affected. Okay, he cannot see, he cannot urinate because of the urinary infection. Okay, it happens urethra for the men and cervicitis for the ladies. And then we cannot climb a tree because of the arthritis. There can be arthritis. So if a patient comes with arthritis, we have to go through all these. We have to ask him whether he's having a problem with the vision, he's able to do the micturition properly, how about his digestion, everything. We look into these factors. It is not simply writing down the prescribing some medicines for him. We look into all these factors. We have to take the history. So there are different kind of arthritis that we see in these cases, inflammatory arthritis. Then we can say arthritis due to the crystals. That is where we can see the gout arthritis. In gout, what happens that everyone knows that is a uric acid deposition. Okay, so the urate crystals are getting deposited in the joints and makes it immovable, and the patients are getting pain, swelling, everything over the joints. In particular, affects the thumb as well as the greater toe. But you can see this gout arthritis happening in other joints, can happen in the elbows, even the ankles can happen. Another one, there is a pseudo gout. Okay, this is pseudo gout. Pseudo means it's a false gout. Again, the patient will be having the typical pain of gout, but it is not due to the uric acid deposit. It is due to a crystal called calcium pyrophosphate. We call it CPPD, calcium pyrophosphate deposition disease. Because of this calcium pyrophosphate only, he is getting this kind of pain. So we see arthritis in these particular areas, typical of gout, but we look into the lab investigations, we don't see any uric acid problem in the blood. So we have to see this calcium pyrophosphate. This can be examined only through taking the fluid from the affected joint. We can see this crystal. Okay, that is another kind of crystal related arthritis. Then we have the infectious arthritis. Infectious means it is due to kind of an infection we get the arthritis. Many infections are like tuberculosis, gonorrhea, syphilis are different diseases that can lead to arthritis. But I would like to give two diseases which is very common in Kerala as well as in other parts of the state also. That is called the chikungunya. People should have heard about chikungunya. Chikungunya is actually a mosquito-borne disease. Aedes mosquito, the same mosquito that is transmitting the dengue fever, is actually causing this kind of disease, and it is actually a viral disease. And in this virus, be transmitted by the bite of mosquito, it leads to arthritis. So that is actually an infectious arthritis. We know that chikungunya, it has affected many parts of the state in Kerala as well as in other states. But I would like to leave a note here. Chikungunya, there is no vaccine still be developed for chikungunya fever, and no modern medicine was able to give a good relief to chikungunya. Only the Ayurveda medicine had proved relief to the people when the chikungunya came. And there is another disease for those who are listening to abroad. There is a condition called Lyme disease. Lyme disease is actually another arthritis. It can lead to arthritis. Lyme disease is actually a vector-borne disease. The ticks is causing the disease. It is not seen normally in India, but this ticks actually carries a bacteria in them, and this bacteria is be transmitted to the skin. And from the skin, you see some rashes around the skin. You may think that it's a tick bite. You leave it like that. But if it's a Lyme disease, of course, you are going to get this arthritis after a few months, after a few weeks, you get this arthritis pain. Okay, so when foreigners come to us, we normally check with them if they had any tick bite or any kind of this kind of illness before they had this arthritis. So, in a nutshell, I would say mechanical reasons are there, inflammatory reasons are there, crystal-borne reasons are there, and then you can be due to the infection. So, all these kinds of arthritis can be clustered, can be given in this category.
Okay, doctor, that was a very, very detailed explanation. So you spoke about mechanical, which kind of relates to osteoarthritis and post-trauma. You mentioned osteoarthritis mostly common among the aged people and people who are overweight.
Yes.
This is because there's a damage in the cartilage, right?
Yes, yes.
And you spoke about inflammatory, which is like rheumatoid arthritis. Swelling is one reason. You spoke about two things, positive and negative.
Yes.
And also you said something can be due to autoimmune disease.
Yes.
And lack of lubrication is what you mentioned, and you also
the synovial fluid. The synovial fluid gets that the synovial fluid is actually getting
right. And it was very interesting to know there is something called I mean, you have psoriasis. You also said there is psoriasis arthritis and SLE arthritis, which both are related to skin disorders. You spoke about spondylitis, too much of calcium deposit and the reason, and then you spoke about urinary infection. Did you say Rheumatoid arthritis? I didn't quite catch it.
It's a Rheumatoid arthritis. It's called
Rheumatoid arthritis. And I mean, I really didn't realize that the symptoms are like somebody cannot see, and vision can be impacted by rheumatoid. That's a very new insight for me. And you speak about struggle in urination and things like that. And gout arthritis, you spoke about that. And then pseudo gout arthritis, and of course infectious arthritis. Chikungunya falls under arthritis for some.
No, chikungunya is actually a fever, but the major symptom that we see in chikungunya is actually the arthritis. Okay. And people spend a lot of time in treating this kind of arthritis, and what happens that ultimately they get a deformed joint, especially the knee. Okay, then only people start understanding the efficacy of Ayurveda. People start using Ayurveda, then they start feeling better.
Interesting.
So Ayurveda was the main boon to them. It was a boon to this kind of patients.
Right. Very interesting. Very interesting. Okay, let me ask you a question. How does Ayurveda relate to modern diagnostics, and what would be the diagnostic reports required for investigating arthritis?
Okay, very interesting question. It's actually we have. I can give you two opinions regarding this. Okay. One is that some scholars may be interested to look into the diagnostic criteria. Okay, the diagnostic, they want to do some diagnostic techniques to understand the thing. And some very scholastic persons, like very aged or those who are very well experienced, they may not write down any prescriptions, okay, for the investigation. But as a doctor, I would say that writing a prescription for diagnostic, okay, we have put some diagnostic, we ask the patient to go for diagnostic investigation. It's actually to educate that patient that what he is actually suffering from. Okay, for a doctor, for an Ayurveda doctor, we have some similar, we have some symptoms being told in our text. We can correlate those symptoms and understand what kind of arthritis. Like in Sandhikata Vata, we have different symptoms. In rheumatoid arthritis, like in Vata Shonida, in Amavada, we have our own style of diagnosing these kind of diseases. But though we diagnose diseases, we want to educate these people Because when a patient comes to us, if we speak about Vata, Pitta, Kapha, he's not interested. He's not interested to learn about Vata, Pitta, Kapha and get into the treatment. He must be made aware of what disease is suffering from and get the appropriate treatment done. Okay. For that reason, we are giving the diagnostic criteria. And it happens to me, it happens to all Ayurveda doctors that if a new patient comes to us, if we put down some prescription, put down some investigation, he will go to the next doctor because he does not want to do the investigation. He don't want to spend the money. And when the same patient goes to a modern doctor, what happens that he is ready to accept all this investigation. He gets this investigation done. But what happens with this? I'm not blaming the modern medicine. I am just saying a fact that modern medicine does not have a cure or treatment for the arthritis. They can only do some symptomatic relief to the arthritis. Okay. So again, after doing the symptomatic treatments, he may not get well relieved of the pain. He comes back to the Ayurveda doctor with the same investigative research which the doctor had already prescribed him for. So what happens that in this scenario, what happens that the patient, even though we had to get a patient the acute state, the patient has gone to sometimes maybe have gone to the chronic state. So our treatment results may also get delayed. Okay. So the diagnostic criteria, we look into the blood as well as the radiologic examinations to understand. In the blood examination, what we focus is like we have different criteria to look into arthritis. That is one is the ASO. ASO is anti-streptolysin O titer. That the ASO test is as we can was said earlier. And then we have RA, rheumatoid arthritis. We say RA positive, RA negative. So this is another result that we like to get from the blood test. And then we have recently we have come to a new diagnostic test called the anti-CCP. Anti-CCP is a very important, very informative test that can say whether a person is prone to arthritis. Okay, so the prone to arthritis, maybe he may not have the arthritis properly. Okay, not in the full advantage. But we come to understand that if he is going to land into a severe arthritis case, because if anti-CCP is positive, definitely he is going to have arthritis in future. So that is anti-CCP because that's a protein antibody test that is the antibody to the protein that we normally see in the blood. This is not normally positive in all cases, but when it comes to positive, means he is having the arthritis. So these are the blood investigations. Of course, there is a routine blood test that we do in order to understand how his immunity is working out there. Because in the routine blood test, we come to know the lymphocyte count, the ESR count. So we come to know whether he's having any kind of infection within the blood. Because the infection in the blood shows that he's suffering from any kind of disease. And then we have the routine urine examination because we have to see the routine urine examination because we need to see how his albumin levels are if he's suffering from any kind of urinary infection and about the crystals of the protein crystals if there is any crystals formation in the urine. We look into these aspects. So that is the blood and the urine examination that we go through. Then we have a radiologic examination. Radiologic examination mostly in arthritis case we do the X-ray investigation. But apart from X-ray, we have this CT or MRI being prescribed. We do this CT MRI only for those who are suffering from severe rheumatoid arthritis in order to understand the nature of the synovial joint. So we want to understand how bad the condition is with the joint. In order to understand that, we may go for the CT or MRI. We don't force the patient. If it's really, we go with this test. But in general, we normally prescribe the blood test as well as the routine urine examination. And particularly, we should not miss anti-CCP if we suspect any rheumatoid arthritis in the body.
It's very interesting, doctor. So what you're telling me is that when a patient comes to you, most of the time, the Ayurveda Vaidya is able to figure out what the type of arthritis through the
Yes.
symptoms.
Yeah.
However, just to give reassure and reconfirm what exactly the issue is, and also to give confidence to the patient, because you said that it seems, I mean, because there's a lack of awareness among the patients, they are more inclined to believe something what a modern science doctor says
Yes.
than what an Ayurveda Vaidya says, and that is what I'm understanding. And you also said that okay, you get some idea through the symptoms. You also want to validate, and that's the reason you ask them to take those blood reports and urine reports, which gives you a lot of data, so
Yes.
that you can take the further course of action for treating.
Role.
You very clearly mentioned something. The modern medicine only can give relief for the symptoms of
Yes.
arthritis, and it cannot cure. And you're
True.
confidently, you're very
Yes.
confidently saying that Ayurveda
I'm
can.
really confident saying, because when you go to arthritis and management in modern medicine, you can only see non-steroidal. Earlier they were used to give the steroid medicine, but they are now stopped completely. They are now giving only the non-steroidal anti-inflammatory drugs. That is called the NSAIDs. They are giving that drugs, and then they do have newly adopted like disease modifying anti-rheumatic drugs. That's what they are giving. This methotrexate is one example of that. But what happens that when you take all these medicines, there are side effects like acidity problem. Whenever you take and you use any medicine, you are accompanied with the antacid. Okay, and then there can be doctors who are prescribing immune suppressant medicines because to suppress the symptoms, they may be prescribing immune suppressant. And in this scenario, when we are going through a phase of corona, COVID-19, this immune suppressant drugs, those who are taking immune suppressant drugs may have little trouble in facing the corona attack. So the immune suppressants as well as the non-steroidal anti-inflammatory drugs, disease modifying anti-rheumatic drugs, they are giving relief to the patient, but not to the complete level. So there is a root level medication is not happening there. They're just giving the symptomatic treatment. Any modern medicine doctors will admit to it, I'm very sure, because they don't have pinpoint treatment cure for this aspect. Okay.
Okay. So that's good to hear. So you also said the modern medicine prescribes you things which may end up having side effects. That's what you said. Yeah.
They do.
Yeah. So there is a. I have a lot more questions to come in. In the meantime, there's a question which has come from one of the viewers. The question is: does RSI, that is repetitive stress injuries, lead to arthritis?
Yes, yes. Like you say, we have March syndrome. March syndrome is actually those who are doing the marching. Okay, every day they like policemen. They go for marching. They do have this repetitive stress is coming to their heels. Okay, so it can also lead to arthritis. So repetitive stress is or can also lead to arthritis if not taken well care. And once you feel that there is a stress happening in any other part of the joint, any part, you will definitely feel kind of pain, and you must immediately take a few medicines. It may be only the topical medication that you would like to have, maybe applying an oil or taking. I don't say that you need to go with the internal medication. Just topical application may be giving you relief for that. So you need to relieve that stress from that affected part. You need to give healing to that affected stress part. Okay, so that will give a immediate relief. That is like a medicine like Murugana or Dhanindra oil can do that magic within no time.
Okay, thank you, doctor. So we have got a lot of education as far as arthritis is concerned.
Yeah.
Now I'm going to go a little deep and ask you this question.
Yeah.
I'm going to put you on a spot, doctor, because you are very confidently saying that we can treat arthritis
Yeah.
through Ayurveda. Can you
Yeah.
please briefly explain to us how Ayurveda can help reverse arthritis?
Okay.
Manage, I understand. How
Yes,
how
sir.
does it reverse arthritis?
Okay. So here I take an anticipatory bail actually. Okay.
Okay.
Okay. You see, reversing arthritis is possible in Ayurveda. We can
Okay.
do the reversing arthritis. I would also say we can also manage arthritis. The reason is that reversing arthritis can happen at the acute stage. As I told, when the patient comes as a very fresh, he's a very fresh person, he's a very fresh patient. If he comes to us, we can do the reversing of the arthritis. We can relieve the arthritis from his body. Okay, with the medication that may extend like to 14 days or 21 days time, we give medicine and he gets relief of the arthritis. Okay, maybe he need to take a follow up after 1 month or 2 months. But managing arthritis will come in the way that if the patient is chronic. You hope you understand that because
Yeah.
of chronic cases, there can be some deformities happening in the body, and these deformities are irreversible. We cannot reverse the deformity that already happened. Okay, there can be deformities may not be evident outside; it may be internal also. Like you see the osteophytes because there is condition like spikes being formed at the end of the joint. We call it osteophytes. If there's too much in number and it's gone bad in shape, it is difficult to reform. They cannot bring back to normal state. So that is again this anatomical defect has already happened there. So in that scenario, we can only manage the arthritis. We cannot reverse it, but in the fresh patients, we can do the reversing of it. Anyway, though I say that this is happening, I would again say that within one session of treatment, this cannot get completely relief from the body. because this has happened over a long period of time. Okay, this disease is not coming all of a sudden. It's not like you are having some rash on the skin, all of a sudden comes, then you put some medicine, it goes away. Because these are all blood-borne diseases. It happens to the blood system, and this blood system is being polluted over a period of time, and then only it is getting afflicted as a disease in the body. So this is over a period of time this has taken place in the body, and for that reason, a one single session may not be beneficial. We may have to repeat the session maybe after 6 months or after 1 year. The reason is that though we have some diet restrictions that we tell in our kind of arthritis, this diet may not be followed completely by the patient because he may not be hard because we have some condition like this Avavada or rheumatoid arthritis Vata Shonda. We may ask him to stay away from taking too much of spicy food, too much sour foods. Okay, don't take alcohol, stay away from smoking. Okay, these conditions will be restricted because we may be giving medicines according to that. These medicines should not be contradicted with this kind of apatyachara or the routine what the patient has normally taken. So in these cases, after taking the medication courses, he may get relief and then he may skip back to the normal routine life. And in that case, he will definitely have to come to us again to cleanse the body and to remove the incidence of arthritis that can happen. So I'll say that arthritis can be well managed and can be well treated in Ayurveda depending on the condition, depending on not only the condition of the disease, but also about the health of the patient. A very weak person having this kind of arthritis will take a little time for it to get cured, but a strong weak person having this kind of arthritis can be easily cured. So depending on the health of the patient, health of the strength of the disease, and strength of the patient, we can do the treatment in Ayurveda.
So what you're telling, doctor, is at an acute stage, it can be definitely reversed.
Treatment. Yeah.
However, it is if it is a chronic case, then it has to only be managed. And
Yeah.
it is interesting to know that, of course, it doesn't happen overnight. It builds over a period of time,
Yeah.
primarily through blood-borne diseases.
Mhm.
And you also said that uh, diet plays a big role,
Mhm.
and if people just don't follow the diet, then they will just derail and just get into the same old habits,
Right.
and
Right.
it may just go haywire. And of course, you spoke about the substance abuse. I just want to know,
Mhm.
what is the role of internal medication and panchakarma
Mhm.
in reversing and managing arthritis?
Okay. Regarding the medicines, we have a lot of medicines stored in Ayurveda for each
Mhm.
and particular ailment. Okay. The medicines, I'm not right to say the names of the medicines in this video because people may take all these medicines, but I just give a brief understanding of this medicine. Okay. We have a particular medicine called Gugulu. That's a common for a mukul. The Gugulu medicine is actually a very wonderful, miraculous, can give miraculous cure in this kind of affair. There are different forms of Gugulu, like Kaishwara Gugulu, Yogaraja Gugulu, and different forms of another different forms of Trayodashanga Gugulu. All these Gugulus are there. Simhanada Gugulu, all these. So these Gugulu medications can do effective relief in treating the Amavata condition, where I said there is an instance of toxin being lost in the blood. It is like a Kapha Vada Hara. And then if you want to choose Vada Pitta Hara, we have other Gugulu preparations. Okay. So these Google prepared medicines are doing a wonderful cure in this kind of arthritis. And apart from that, the internal decoctions like Rasna Sapta Kashaya, Rasna Aaron Dadi, Maharasna Kashaya. So these are different Rasna based medicines that is giving relief in these kinds of arthritis. And even when it comes to gout arthritis, we have a Kogilaksha Kashaya, Kogilaksha. This is actually a good medicine to relieve the uric crystals being deposited in the joints to get relieved away. In modern medicine, they give allopurinol, but in Ayurveda, we have this kind of medicine. Okay. Regarding the punch, these are the medicine that we give. But all of a sudden, if any person comes to us as a patient, these medicines may not be given immediately. We look into the dosha aspect, as I told earlier, and then we give a preparatory medicine in order to correct his digestive system. The metabolism will be corrected in the initial phase using a few medicines, and after that course of medicines only, he will be given the main course medicine. So the patient may not be very comfortable with the first set of medicines because he may not give immediate relief. But the next, once we go with the next set of medicines, he starts feeling the relief from the pain. So that is the different system. The preparatory stage is there, the main procedure treatment is there, and then we give the last will be the to follow the rasayana therapy. We give some rasayana medicines like Pipili Vardhama Rasaya. Even the Chavanapasha can also do good relief in tackling this kind of arthritis. Because Chavanapasha is like a auto if there is any autoimmune problem, it is working as an immunomodulator. That's the reason why government has told that Chavanapasha can be given in this COVID-19 management because Chyawanprash is actually immunomodulator. Okay, so this again is as you know, arthritis is as from the concept of modern medicine, it's autoimmune disease can happen in arthritis, and this autoimmune can be regulated using the immunomodulator drugs like Chyawanprash. So that will be coming in the last stage. Regarding the Panchakarma can only be done when the patient is with us for a quite period of time. Okay, the patient has to stay with us minimum 14 days to 21 days. Then only we can do this kind of Panchakarma treatment, like Virechana and Vasti treatment. These are the two main treatments that we adopt in treating the arthritis. And Virechana is actually to remove the toxin that is been lodged in the body. We prepare the body for a detox, and then we do the Virechana therapy. And then there is a Vasti. For the Vasti to be done, we need a gap between the Virechana. So from the like we put a 5 to 7 days gap from the Virechana therapy, then only we can do the Vasti. Vasti we do with the oil treatment as well as with the Kashaya decoction. Okay. So that's the reason why I said the patient has to stay with us for 14 to 21 days. Then only we can give an effective relief to this kind of disease. So Panchakarma, Vasti and Virechana that we adopt in cases of treating arthritis. And there are many medicines that we can prescribe in arthritis depending on the condition of the disease.
Okay. Okay, doctor. You spoke about Guglu medicines. You spoke about other internal decoction, basically kashaya, different types. And you also said that if somebody has to go through a panchakarma, there are some preparatory process that you need to do. They have to take some medicines, and minimum we're talking about 14 to 21 days, where you have to do virechana to remove the toxins, and also vasti
Yeah.
as one part of panchakarma to treat people to manage arthritis. Okay, so we have another maybe 10-14 minutes. Do we have any questions from audience? Okay, okay, so we have responded to one question from an audience. So I have one more question. What would be your recommendation for managing arthritis in our daily lives? Especially if you can tell this is what we should do, this is what we should not do.
Okay. Okay. So we do have those patients, those who are having affected with arthritis, they can follow some diet pattern as well as some exercise pattern. Okay. People do have tendency that being an arthritic patient, he cannot do anything, but that is false. Actually. He has to go with some kind of exercise. Okay. Maybe stationary exercises where he has to move some joints. Even the physiotherapy ball, he can with the physiotherapy ball, he can do some exercise. So some kind of movement should be there always to the joint in order to keep the joints movable. And then regarding the diet, as I said before, there are conditions like in Ayurveda we say that the pungent taste or the very spicy taste, taking too much of sour food can lead to arthritis because this is actually vitiating the vata in the body as well as the recta is getting vitiated because of this continuous usage of these kind of taste from the food items. Particularly, I would say like highlight this intake of curd. Curd is not being advised as a very good uh, fluid that we need to take. Okay, you can take the buttermilk. So instead of curd, you need to take buttermilk. Buttermilk we say that sakram, that's called in Ayurveda sakram lagu kashaya amla jivana kapha vada. That actually means that the buttermilk has the potency to overcome the vitiated vata and kapha. If there is any kapha vada imbalance happening in the body, it can be corrected by intake of buttermilk. But curd is reverse. Curd is actually is denser and it can give some kapha related problems. Even it can vitiate the blood, leading to the skin problems. So intake of curd has to be, if possible, it has to be stopped. Instead, you can go with the buttermilk. And again, the taste you should have a balance of all taste methods. You should not be sticking only to the spicy food or taking too much of sour food. I would say that there is also a recent study that too intake of too much of vitamin C like citrus food can lead to arthritis. That has been a study reported in 2004. In 2004, there was a report stating that taking too much of citrus fruits with too much of vitamin C can lead to arthritis. That is the report published. You can go through the, you can see in that on the website also. So this kind of too much sour foods is not good for the blood, and in turn it can affect your the arthritis. And then we say regarding the supplements that you need to take, like you can have more calcium and vitamin D. Okay, calcium and vitamin D is very important for the bone growth and for the bone strength also. So arthritis, of course, you know that it is actually related to bones also, because the bones is also having the wear and tear. In order to stop uh, the deterioration of the bone, you need to go with the, you need to take calcium and vitamin D. This can be supplemented through the food also. So this is a taste that you, a considered taste you can have. You can have a restriction on the spicy and the sour food. Regarding the intake, you can take vitamin C to some extent only, not too much. And then we can take vitamin D, and calcium is very much required. And then we have to say that this condition, like those who are anemic, because iron does have a very important role in arthritis. Those who are anemic, they have a tendency to have uh, the swelling, which we call Pandujanya Shofa, because can be inflammation in different body parts due to the anemia. So this anemic, you need to have to good folic acid and iron supplements, because folic acid and iron is very much essential to have to release arthritis from the body, because it can protect your blood system. That is why you can just avoid getting autoimmune problems in the future by keeping a good blood circulatory system in your body. And then we have other supplements like you people have heard of this chondroitin, glucosamine. Then we have hyaluronic acid. These are all supplements that is available in the market. You can supplement these medicines, but these medicines, I'm just taking out these names of these medicines because this does not have any contradiction with our Ayurveda. Those who are taking Ayurveda can also get supplemented with the chondroitin and glucosamine. Even Ayurveda drugs do come with the combination of glucosamine. The glucosamine is actually medicine. It's actually being extracted from the shells of the mollusk, shells of the shellfish. Okay, so this is glucosamine, and it can also be prepared from the vegetarian sources like from the fungi or from the microbes. It can be cultured, but that is little expensive. So people mainly go with the low cost medicine like from the shells of the fishes. They make this chondroitin as a glucosamine medication, and this can be supplemented along with the Ayurveda medication. So these are the things that you need to follow. And regarding the exercises, I would say that you should not be very sedentary, because too much of sedentary jobs will actually lead to blocks of these doshas in your body. Your doshas is getting blocked in your body because of your sedentary habits. So you need to move, you need to work out, you need to allow your blood to circulate very effectively throughout the body. The blood should not circulate normally; it should be get heated also. That's why we say do exercises, because when the blood gets heated, because of the temperature changes, the removing of toxins from the blood is very easy, because when it goes to the filtration stage in the kidney, if it is warm, the blood is warm, it has the tendency to flush off the toxins from the body. So that should be understood. And even like too much of urine, urate, crystals, everything, this kind of formations, excess of proteins can be easily digested when you do exercises. So there is no chance of uric acid deposit in your body. So these exercises and diet is very important. Another important thing which you cannot avoid in India is actually jerky rice. Okay, because you should avoid jerky rice, because you need to adopt to those kinds of vehicles in order to avoid jerky rice. Because I know, because the temperature, the climate in India is not favorable for our roads, because the roads get potholed immediately after a rain shower because of the temperature variation. And in these pothole roads, if you go on regular basis with a two-wheeler, there is a complete jerking of your body. So this jerky rides is not good for the body in terms of arthritis, because in Vata Vyadhi we have the acharyas are already advised that avoid jerky rides, because this can lead to arthritis in the later stage. So you need to shift to new vehicles, or you can use the public transport. Not now, after when situation comes back normal, you have to rely to public transport in order to avoid such a heavy jerky movement. Okay, so these are things that you need to adopt, and of course, drink hot water, and only the hot drinks has to be taken. Too much of taking cold water is not good for the body in case of arthritis, because in arthritic patients we always advise not to go with any kind of cold food stuff. all cold food items has to be stopped because we first relate the vata as the main culprit for this arthritis, and there is a blockage of water. When you take too much of cold foods, again this blockage is happening. So to avoid that, you need to take only the hot food items. So that is
Fantastic. Fantastic, doctor. So, in summary, what I understood from, I mean, you gave a detailed explanation. I was keeping notes. So, what you're telling is there are four important things that you need to do on a day-to-day basis, just to make sure that you avoid out and manage arthritis. One is you spoke about diet, you
Mhm.
spoke about exercise, and then you spoke about avoiding jerky rides, which are bad for your knees, and also about consuming hot water and avoiding cold food completely, because you said that is related to vata.
Yeah,
It increases the vata, and vata is the root cause for your
arthritis.
arthritis, right?
Yeah. And
And
I would like to add one more thing.
sure.
That is actually turmeric, the concept of turmeric. Okay, kurkuma. Okay, so this turmeric is also now being considered a magical remedy in treating arthritis, because when you look into many of these patented drugs, you can see turmeric is also been imparted in the content. Okay, turmeric, because of its anti-inflammatory property, turmeric is giving a good result in treating arthritis. So what you people with arthritis should do is that just take haldi ka doodh. Okay, haldi ka doodh means you have already calcium there, and then you have turmeric there. So this haldi ka doodh will give a good relief in treating arthritis. And also, if those who are not very fond of milk, they can just mix turmeric powder in the hot water and take it. Because this turmeric can give wide relief to the arthritic patients, as well as also can prevent diabetes also. So those who are suffering from diabetes, hypertension, and they have this arthritis in common, they can go with this turmeric inducement.
Fantastic. Fantastic. Okay. Also, doctor, when you spoke about exercise, you said do stationary exercises, so that you give exercises to the joints so that they can move. And as far as food is concerned, avoid sour food, which will increase the vata. Curd completely avoid. That's what you said. You can have buttermilk, and you need to balance the taste. Just don't get inclined only to spicy food or some particular type of food. You said too much of citrus, though it can help improve the immunity, it may not be good because it can also contribute to arthritis. That's what you
Yes,
said.
yes,
um, Take a lot of calcium and vitamin D, because that's going to help you in the bone growth and strengthen your bones.
yes,
um, Anemic iron deficiency also can be an issue as far as arthritis is concerned. So you have a lot of iron folic. You
yes,
spoke about supplements like glucosamine, which is extracted from the shell of the shellfish. uh, and of course, you said don't use arthritis as an exercise to not exercise, excuse to not exercise, because too much of sedentary will not allow the blood to circulate properly. And it
okay,
is important that your blood has to circulate and it has to be kept warm, right?
yeah, yes,
And finally, you said turmeric is like a magic
yeah,
uh, ingredient, and you very beautifully said, okay, you use turmeric and then you use milk and have it, so you get the calcium as well.
yes,
um, it has been an amazing input that I personally have got from this particular webinar, and I hope that the viewers also went through a very similar experience. Before I close, I have one more announcement. Next Saturday, that is the 5th of September at 5 p.m., we have another webinar,
okay,
which is going to be on autism. It's a very hot topic. We have a special guest who is going to talk about that. In the meantime, for the viewers who are here, if you want to get a teleconsultation done, please drop a message in the Facebook, and one of our wellness advisors will get in touch with you. And with that, Dr. Harshad, thank you very much for taking time on a Saturday evening. And I personally learned a lot, as I mentioned to you. And we hope to see you in the future with some other insights and some other topic. Thank you
yes.
so much.
It was my
Namaste.
pleasure to be here. Okay, and I thank all the viewers for watching this video. I thank all the team members of AyurUniverse to give me this opportunity. Thank you so much.
Thank you, doctor. Thank you so
Thank,
much.
thank you.